So, what is breast implant illness? It's kind of a nebulous constellation of symptoms. It's not one thing. It starts with, things like symptoms like brain fog, uh, symptoms like joint pain, muscle pain. Some people say Raynaud's phenomenon or syndrome, which is the vascular problem with your hand where your hand turns blue and red depending on the temperature. But it's a constellation of these symptoms that kind of fall into like rheumatoid or rheumatologic issues where you would see a rheumatologist because this is an immune system problem. And typically these patients fall into these have these symptoms and fall into this category, and they often just go see their rheumatologist because they feel terrible. They feel like they got flu, they're fatigued, they got muscle aches, brain fog, all the things I mentioned, and they go see their rheumatologist, and they have a full, what we call jokingly, $1 million workup to make sure that they don't have rheumatoid arthritis, make sure they don't have Sjogren's disease, or make sure they don't have psoriatic arthritis, or any myriad of known autoimmune diseases that cause fatigue, changes in your lab work, such as blood counts, uh, markers in your blood that show that you have kind of ongoing inflammation. Again, all the symptoms that I talked about, hair loss, brain fog, so on and so forth. But what happens with this subset of patients, they really don't have strong evidence of known diagnosis of these problems. They don't have the blood test that would point directly to having uh, rheumatoid arthritis or systemic lupus.